Welcome to Prescribed by Dr. Nathan Goodyear, where integrative oncology meets holistic healing. This podcast is your home for the latest in innovation, exploration, and elevation in all areas of integrative oncology, medicine, health, wellness, and beyond. Join me and a host of other innovators as we go from practicing to prescribing. Your daily dose of wellness begins now. Should ivermectin be available over the counter? Now, that's a very hot topic on the internet, on social media today. And the way I would present this is we have to understand what ivermectin is in the context of things. When you look at integrative medicine, when you look at integrative oncology, and honestly, when you look at anything, there are flagships. There are the bearers of that field, of that practice, of that thought. And vitamin C, for example, in integrative medicine and integrative oncology has long been that flag of integrative medicine. Thus, there was great efforts to destroy its credibility. When you look at Linus Pauling and Ewan Cameron, in 1976, 1978, they gave IV vitamin C and were shown to improve quality of life and extend survival in patients with terminal disease. And then there was a combination of three people, Mortari, Cragen, and Fleming, that did the same study. But what they did is they actually did it via oral vitamin C, same dose, but oral vitamin C. And then they used that to basically discredit Pauling and Cameron's work. And honestly, what they criticized them of doing was exactly what they were doing. They weren't constructing the studies well. They had a complete lack of understanding of basic pharmacokinetics and pharmacodynamics. But anyways, that's what the political class, that's what those that control the narrative and the playing field in the market sought to manipulate and use. And when we look at that compared to repurposed medications, because this is a big movement, repurposed medications is a new movement, 2004, but it's building because it gives power back to the patients. But what's happened here is that doctors, particularly oncologists, they've turned their back on patients. And this has left patients to wander the wilderness on their own. And, I started a repurposed medication website called offscriptrx.com. And I did that because as I talked a little bit about some of the exciting potential, of repurposed medications in oncology, the comments I would see in the section below was startling what people would talk about and how people would jump in and hijack people and take them out to websites that were very questionable and information that was highly suspect. And so when we look at that repurposed medication movement, similar to vitamin C and integrative medicine, and repurposed medications here are in the integrative oncology movement, ivermectin is that equal flagship. It's a four-letter word from the conventional standpoint. It just doesn't have four letters. Ivermectin. And what I've said before about ivermectin is really interesting when you look through the historical timeline of it. It was the wonder drug. It was originally described that as its work as an antihelmintic, but it's then quickly transformed into wonder dog as it became prominently used and approved for animal consumption. Then it became a wonder dud during the pandemic, brought to you by the Saturday Night Late Show hosts and their scientific rigor in announcing that. And then the last became a wonder drug again as it relates to its work in cancer being repurposed. So there's been this movement back to the question, should ivermectin be available over the counter? Now, I would tell you to begin with right now, the answer is no. Now, I can see the reasoning why people would target and say ivermectin needs to be over the counter. There are some countries that have it over the counter. However, there's a thinking and a logic here in the United States that I think that would require us to better put that, keep that behind the counter at the pharmacy, but actually empower doctors and inform doctors how to properly prescribe it based on the indication, because there are adverse effects, side effects associated with ivermectin. Yes, they are rare, but yes, they are quite real. So the reason why I want to touch on this is because I think when people are talking about ivermectin over the counter, there are people and there are advocates that are saying that ivermectin has no risk. That is just not true. And I want to highlight a recent study that was published to really bring to the forefront of your mind uh, potential concerns about ivermectin. And the reason why, as a clinician, me as a doctor, both an MD and an MD homeopath, we have to not only look at the effects, who's a good candidate, but what are the potential adverse effects? And we have to know the risk. We have to think clinically in that aspect. And that's just something we've been trained to do. And it's something that patients should not be required to do, and they're not trained to do. And again, the issue, I think, why we're at the point that we're at is because doctors have turned their back on patients. I'm not saying keep this from patients. Please, that's not the case at all. What I'm saying is we're in this predicament right now because doctors have turned away from patients on this and left them on their own. And unfortunately, there are people that have maybe a bit of truth and expound on that, and maybe have no truth and expound on that too. So this study was published in 2024, so up to date. It was entitled The Detrimental Effects of Pretreatment with Ivermectin on Myocardial Ischemia, published in the journal Pharmacology. Now, what's interesting about this is it was an animal model. It was ex vivo and in vivo, meaning ex vivo is taking living tissue out of a living organism. Actually, that term ex vivo is Latin, meaning out of the living, kind of like Halloween-esque, but here it's taking tissue out to study it, and it's used in science to describe experimental measures performed on tissues or cells that have been removed from these living organisms. So here it was actually looking at the heart, so the cardiac muscle. Now, what they were looking at here was that the broad spectrum antihelmintic, antiparasitic ivermectin, but know that it's been shown to have antibacterial, yes, antiviral, and anti-cancer. Now, there's complexities in that, timing, dosing, stacking of therapies with other, all play a key role here to understand that. But the point here is, should ivermectin be over the counter, and is there risk that a physician would best be available and able to prevent and offset? Well, in this study, they actually induced heart attacks in these mice. Now, you may say that's cruel, and yes, it is, but they did that because they wanted to see, by giving ivermectin in these mice that then had resultant ischemic heart disease because of the myocardial infarction, what was the associated risk? Now, why is that important in the United States today? Well, according to 2022 data, 4.9% of all adults in the U.S. were diagnosed with coronary heart disease, a form of just one type of ischemic heart disease. So right there, you can see, oh, wow, 5% of the entire population has one type of ischemic heart disease. And then looking at ischemic heart disease, most research points to it as the number one cause of mortality in adults over the age of 50. And that's ischemic heart disease. That's why it's referred to often as the silent killer, because ischemic heart disease is something you don't see until there's a massive event, catastrophic event, and often mortality associated with it. But what's scary about ischemic heart disease is not that it's the number one cause of mortality in some studies in those over the age of 50. Again, I've talked about the prospective urban rural epidemiology studies that relates to cancer in high-income countries being the number one cause of mortality in adults. So there is conflicting data, and debate and discourse, understand, is the proper construct of science, of medicine. Whenever people say the science is affirmed, confirmed, and settled, that in of itself is really not science. There's always debate and discourse as new discovery comes about. But the incidence of ischemic heart disease in those younger than 50, so age 30 to 50, is actually skyrocketing. Again, silent killer. And of course, this correlates with many other lifestyle issues, obesity, overweight, etc. So what we see here is, okay, the risk profile is increasing. And the use of an over-the-counter medication, which has great benefit, ivermectin, great benefit, I've been using it since 2018 in the treatment of cancer. But there can be some risk there. And it's going to be a risk in individuals which wouldn't show that risk on its surface. And as a patient, they wouldn't know it. They wouldn't know it until that event happened. So let's go back to the study, because we doctors have to think like that. Okay, so here's the drug, here's the potential indication. Particularly repurposed medication requires much more thorough investigation and knowledge outside of conventional medicine. But who is a good candidate and who might not be a good candidate, who might need further investigation before they become a potential candidate? So what they did in these mice is they actually divided them into 4 groups in the in vivo. They had the control group, which obviously got nothing, the ivermectin, then the group where they gave the myocardial infarction drug, and then that was given over 2 days, and then the myocardial infarction drug plus ivermectin. So those were the 4 groups. In the ivermectin groups, they gave 0.2 milligrams per kilogram. Now, when you look at human studies and the toxicokinetic profile, that should be well within the safety profile as what is a safe dose in human use. Even human equivalent doses, you're going to see basically potential toxicity only rearing its head at greater than 2 milligrams per kilogram, and some other studies in animals that get translated to human equivalent doses goes much higher. But should ivermectin be available over the counter? How about this for a quote? At therapeutic doses, ivermectin does not readily penetrate the blood-brain barrier where GABA functions as a neurotransmitter. The therapeutic dose recommended is 0.2 to 0.3 milligrams per kilogram per day. Maximum dose of 0.4 milligrams per kilogram per day. So they're talking here not about cardiac toxicity, but actually about neurotoxicity. So here's another quote. Neurological adverse effects have been reported in those treated for parasitic diseases in doses above 2 milligrams per kilogram per day. So that 0.2 milligrams per kilogram per day, you can see is well below where we start to see some of the neurotoxicity. And what might that be? Well, that could be things like coma, could be things like respiratory distress. So we're talking about real catastrophic, life-altering impacts associated with ivermectin. Granted, at high doses, but 2 milligrams per kilogram per day is not really a high dose when you get to think about it. Because what you see people advocating all over the place on the internet is doses that are sky high, that are actually inducing double vision. They're actually inducing dizziness because you're overcoming these drug efflux transporters in the brain that pump it out. And so you're overwhelming that, you're saturating it in the brain, which you go, that's a good thing. But here you increase the neurotoxicity. But so I think it's important to understand that this risk is there. And when we in America think a lot is better and a whole bunch is great, that's our mentality. Something like ivermectin, which has a very good safety profile, put it in the context of where we as Americans like to take things, where we like to take a whole lot of it, then we run into potential problems in patients that on the face have no risk. So back to cardiovascular risk here. So in these mice that they induced myocardial infarction with and then gave them ivermectin, okay, what they found is very, very interesting. They found that it worsened the cardiac ischemia. So if you have a heart attack, then you're going to have ischemic heart disease following that to some degree, especially in the short-term phase. So clearly you have to take this in context and think, okay, this is in the very acute post-cardiac event phase. Now, the question here what does that extrapolate out over time as the heart heals? That question cannot be answered here. Okay, we have to be honest about the limitations of this data. And yes, it's an animal study too. So does that translate to humans? We don't know that, but we do know that adverse effects are associated with ivermectin. And so that does then seem to correlate. But here we're talking about the acute events of those, acute time frame of those that have an acute cardiovascular event. So it worsens the cardiac ischemia, number one. Number two, it increases cardiac arrhythmias. These are the irregular rhythms associated with the heart that can lead to throwing blood clots throughout the body, a cardiovascular event, stroke, etc. So again, one can beget the next, and ivermectin could, I of course say could, be the trigger that precipitates that by worsening cardiac ischemia and increasing cardiac arrhythmia. So somebody here may not even be, post-MI, but they could have a chronic AFib condition. So thinking outside the box here, chronic AFib condition, and they're on medication that keeps it controlled. They take a high dose of ivermectin and boom, all of a sudden they go into AFib uncontrollably. And of course that increases their risk as they go to the ER. Third, associated risk here is increased myocardial dysfunction. Myocardium, that's the muscle of the heart. And so what we're seeing here is dysfunction of what the heart actually does. And what they actually showed was it lowered the left ventricle contractility. Now, the heart has 4 chambers. The left chamber, particularly the left ventricle, pumps the blood out through the aorta to the rest of the body. So it's a very important compartment, that left ventricle. And so if we get a dysfunction in that chamber, if we get dysfunction in that contractility, we are going to get a limitation and dysfunction in that blood being pumped throughout the body, perfusion, oxygen delivery, etc. So you can see the potential impact there. And finally, what it also did is it caused hypertrophy. And of course, this is a component of that myocardial dysfunction, particularly in the left ventricle, leading to that left ventricular hypocontractility. So it's not contracting well. So when we ask the question, should ivermectin be available over the counter? For me, I think the evidence points to enough concern that we should say no. I don't even think we would be having the conversation, should ivermectin be available over the counter, if doctors were open to thinking, novel concept, open to thinking, but then work to actually inform themselves. The system allows doctors to learn outside of quote unquote the narrative approved medical system, and they could actually engage with patients on the context of repurposed medications. I think patients and doctors could come together to actually appropriately provide and supply a safe drug safely to all patients. Yeah, there would be some patients that you would probably wait, say, let's do a cardiac workup, make sure that the ischemic heart disease is not enough. Let's start low on the ivermectin, taper ourselves up. But if we leave it over the counter, I've seen so many patients taking massive doses, hundreds and hundreds of milligrams of ivermectin multiple times a day. And again, when you look at what they talked about, less than 2 milligrams per kilogram, that's not hundreds and hundreds and hundreds of milligrams of ivermectin per day. That is much lower doses. And we have to understand we're not just treating a condition, we're actually looking at those who are at risk for undisclosed conditions and side effects and adverse events. So that's the mind of a physician, is to properly prescribe, but properly select those that would not be good candidates for prescriptions. And this study highlights that in a disease that is called the silent killer by many, and it's one that is going to be very prevalent over the age of 50 in the United States, but also increasing prevalence in those 30 to 50 years of age. And that's a large subset of people in the United States. And it's concerning if there's a push to actually have this available over the counter. So understanding that, like vitamin C, it's a flagship. Ivermectin is a flagship. Love both of them. Been using both of them a long time. Vitamin C, of course, IV, much longer. Those that are opposed to it are going to try to destroy it. They're going to try to discredit it. They're going to try to call anybody that's using it as a quack. They're going to misconstrue and misuse the science.
And we have to not fall trapped to that same pattern that I see happening in repurposed medications, and ivermectin being that flagship. If they can discredit ivermectin, if they can put patients at risk, then there's the ability to pull it from availability, pull it from market, and restrict and limit patients' access to it. But we as physicians, we have an obligation to be an advocate for our patient. And here, engage patients with ivermectin, assess patients appropriately, and then appropriately prescribe this. So ivermectin, in my opinion, should not be available over the counter because there are associated risks, though small, though rare, that we should be aware of as clinicians to appropriately prescribe this. And also, I think most of what people are taking with ivermectin as it relates to cancer, they are taking too much. And herein lies a potential increase further of that risk. I think what we need informed, trained, educated doctors that are willing to think outside the box, critically think for themselves, not fall into the group think, and actually engage their patients and be advocates for their patients in repurposed medication. So no, we should not have this available over the counter. But what we should have is doctors that will step forward, learn, educate, and properly assess risk and prescribe ivermectin. Pharmacies equally need to step on board, and they need to properly educate themselves, because that's part of the problem. They're not educating themselves, and they're seeing themselves as the obstacle to doctors prescribing medicine, which, by the way, is not in their scope of practice. But what they're doing is they're stepping in to block it. They're equally culpable in stopping patients' access to this. So doctors need to be that advocates. They need to engage with both the patient in therapy, in risk assessment, but they also need to engage with pharmacists as well, so that we can together form this triad that benefits the patient, properly prescribe ivermectin safely, assess risk of those who are potentially at risk, and then properly prescribe it for them across multitude of diseases. But obviously as an antiparasitic, antiviral, antibacterial, and of course, what's important to me is anti-cancer. Please check out the show notes in this short reel or intermediate format of content that we have here on YouTube. You'll find it over in Rumble as well, because there you're going to find the supporting evidence that supports my conclusion as it relates to this risk, including that 2024 study. And we will see you on the next Hot Take. I'm Dr. Nathan Goodyear.
Thanks for joining us on this episode of the Prescribe Podcast. All references supporting this episode can be found on the prescribe.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribe. We'll see you for your next refill.